Good afternoon. I'm Gordon Oliver, the clerk for today's meeting, and I'm supported today by Phil Rumans as the Zoom host. Members, please note that the slide about to be shared on the screen shows how we conduct our meetings via Zoom. In addition to these points, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised the Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Please note that any voting will be done by a show of physical hands, and if we need to adjourn the meeting for any reason, then you'll be advised of the revised time and date of the meeting. If it's a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent out. Do members have any questions about the way in which the meeting will be run? Thanks, Phil. If you could take the slide off. Thank you. So due to a recent reshuffle of the executive portfolio holders at West Berkshire Council, our first item of business will be to elect a new chairman. Do we have any nominations for the role of chairman of the Local Outbreak Engagement Board? Councillor Doherty.
Thank you. If I may, I would like to propose Councillor Graham Bridgman as chairman.
Thank you. And does that nomination find a seconder? Councillor Stewart. Thank you. Are there any further nominations for the role? I'm not seeing that anybody wishes to speak. So we'll move to the vote. Can I please ask members who support the nomination for Councillor Graham Bridgman to be elected as chairman of the Local Outbreak Engagement Board to please raise your hands? Okay, thank you. That's confirmed. I can now confirm that Councillor Graham Bridgman has been elected as chairman of the Local Outbreak Engagement Board. Over to you, Chairman.
Thank you, Gordon. And I hope you can hear me. I can see Gordon, but I can't.
I think we may have lost.
Gordon, Councillor Bridgman appears to have lost connection. So while we wait for him to come back, I think what he was about to say was he would like to propose Councillor Joe Stewart as his deputy or vice chair.
Okay, and do we have anybody to second?
And I'm happy to second that.
Thank you. So can we can I please ask members who support this nomination for Councillor Joe Stewart to be vice chairman of the Local Outbreak Engagement Board to please raise your hands? Thank you. So Councillor Stewart, you're now the vice chairman. I think given that we've lost our chair, you cross.
Well, thank you all and welcome to the meeting. I shall be remembering this with Councillor Bridgman for many years to come, I'd just like to say. While we're hopefully he'll be able to get himself back and connected. This is my first meeting in attendance, although I have watched them and taken the opportunity while they've been running. So that's been very useful, and I'm sure lots of people are also doing the same. So item 1 on the agenda is apologies. Gordon, do we have any apologies?
Yes, Nick Carter has given us apologies. Okay,
lovely, thank you. Item 2, minutes of the previous meeting dated the 15th of March. I wouldn't normally go through each individual page, but does anybody have any amendments or any questions? Lynn?
I was just going to propose them as a fair and accurate measure for you, Councillor Stewart, because I'm conscious that you weren't actually here for that meeting. I have been through them and I'm happy to recommend them to you.
Okay, lovely, thank you. And it looks as if is somebody seconding, or are we all saying yes, we agree?
I'm happy to second.
All right, lovely. Thank you, Councillor Masters. Do we normally vote on them as well?
I believe so. I did. It's my first lower meeting as well. So.
Okay. Oh well, we're learning together, Gordon. So why don't we just vote anyway? So is everybody happy to support that? That's a true and accurate record of the meeting. Thank you. Wonderful. Okay, number 3 on the agenda, declarations of interest. Does anybody have any pertaining to items on the agenda? No, looks like we're good to go. Item 4, COVID-19 situational report. Who would normally deliver that?
That's me. I can do that, Chair.
Thank you, Matt.
Okay, welcome everybody. So as always, just going to give a brief update for the surveillance. I was also going to cover a little bit just about testing and also on long COVID, which I believe Councillor Masters requested at the last local outbreak engagement board. So the summary, as many of you will know, is a much improved position and maintains that way. So COVID-19 has reduced in the vast majority of local authorities across Berkshire as a whole, although 2 of the last 6 local authorities, West Berkshire being one, has slightly seen an increase over the last week or 2. I think we just need to be mindful now that numbers are, because they are quite low, if we do experience any outbreaks, it can quickly fluctuate the rate quite significantly. So an increase doesn't necessarily mean that we need to be alarmed, but clearly something we need to keep an eye on. So over the last week, there's been 50 new cases in West Berkshire, and that's remained relatively static over the last few weeks. So I just want to emphasise that point, because whilst the weather's improving, more people are being vaccinated and rates are going down, COVID is still very much with us and here to stay. So we need to maintain our guard in terms of social distancing and all the other measures that we need to take to protect ourselves and one another. So as you can see from here, we've just got the local authorities on the left-hand side, the southeastern England at the bottom. The number of individuals tested is reducing slightly week by week. We have seen an increase. Obviously, the number of lateral flow tests that we're now deploying across the local authority will help in terms of increasing the number of people accessing testing. And we also need to be mindful of that when we're looking at numbers, that actually we will obviously pick up people we wouldn't have done before, because the number of lateral flow tests are increasing in the community and we are testing a lot more asymptomatic individuals. I've got a hand up, so I'm happy to take a question now, Councillor Masters.
Thank you, Matt. I was just going to ask about the lateral flow tests. Do we have any figures on what their efficacy and accuracy is at the moment?
That's a good question. So with the lateral flow tests, what they tend to be less accurate as the prevalence in the population of COVID reduce. And as from today, what the government have advised is that anyone taking a lateral flow test should have a follow-up confirmatory PCR test because of that very reason. But generally what we know about lateral flow tests is they are very good at picking up people with high viral loads. So obviously they're a cheap and effective tool that people can quickly do, whether at home or at one of our community test sites. So we're strongly encouraging people to do that. And if they do get a positive result, what we're asking them to do is to self-isolate and then seek a PCR test at one of the national testing sites or regional testing sites, or book online. So we in public health are confident in terms of lateral flow devices are a really critical tool to support the ongoing COVID pandemic. Does that answer your question?
So they would have to, you recommend getting a test if they test positive on the lateral flow.
So as things stand, there's new guidance come out today saying anyone that has a test can do a lateral flow device. If they are tested positive, they should immediately self-isolate as they would. But what the government are now advising is that everyone should also get a follow-up confirmatory PCR test if they test positive. But I want to be clear that lateral flow test device is for asymptomatic, and it's not for people that have symptoms. If you have symptoms, you should get a PCR test.
Excellent. Thank you, Matt. That's great.
Andy, I see your hands up.
Thanks, Matt. Just on the lateral flow test. So previously the guidance was if you had a positive lateral flow and then you had a PCR test that was negative, the lateral flow test still meant you had to self-isolate if you were in a school environment. Has the guidance changed around that as well, do you know?
Just trying to unpick what you said. So say that again, Andy, sorry.
So previously, if you had a lateral flow test in a school that was positive and you went and had a PCR test and it came back as negative, you still had to self-isolate from school because the lateral flow test was positive. Has the guidance now changed so the PCR test takes precedence over a positive lateral flow test?
Yes. So what we're saying is that PCRs you'll be required to get a PCR for all positive lateral flow device. So that will trump a positive LFT, correct? And that's one of the challenges we've got with this, is the guidance does change so frequently. It's obviously communicating that with the public, but irrespective of whether you have a lateral flow test at work, at home, at the school place, they all have to be followed up with a confirmatory PCR. So that's the same regardless of where you actually have the test. Hopefully that will make it slightly easier, because it did vary beforehand. Councillor Mass, is that a new hand? Right. Okay, so going back to this slide, so the positivity is 1.3%, so that's dropped quite significantly from 3.7%. Our cases per 100,000 is 31.6. And I've just looked at the most recent data, is 32.8 per 100,000. Really good news in terms of the cases per 100,000, so really low in West Berkshire. Out of all the local authorities, only 2.5 per 100,000 positive cases. So again, as I've said many times before, it's good news that those rates are so low, because we know those are the ones that are affected most from COVID. In terms of the epidemiology curve, again, it just really shows where we've got to. So we've 6,725 cases to date, and you can see since the end of February, maybe beginning of March, it's been relatively static across West Berkshire, and that mirrors very much what's happening at the regional and national level. And then in terms of the map, again, the light shaded blue just shows that these are the rates where there's 25 to 50 per 100,000 of cases. As you can see, as you just move towards the east, that's where the rates are slightly higher, but again, they are coming down slowly. Some areas are a little bit more stubborn than other areas. In terms of the electoral ward, as I said before, because we are dealing with quite small numbers now at the moment, the numbers will fluctuate quite significantly within the wards. I see a lot of our wards haven't had any cases. This is from the 13th to 19th of March. We've got the wards on the left-hand side. A number of our wards haven't had any cases, but some wards have. As we do, you might recollect from previous waves, as numbers do get lower, we tend to round up to the nearest 5, just to avoid any identification of cases within those specific areas. And then just to the right-hand side, we obviously have the total cases and total rates per 100,000 since beginning of the pandemic in March 2020. In terms of the hospital activity, always slight dated. I think that the good news coming out of that is the number of admissions are reducing quite significantly, and also those individuals on mechanical ventilation is extremely low now. So there's still the after effects of that wave that we're seeing in hospitals, but it's good news on the hospital front. And the same with deaths. We are sadly seeing a number of deaths, 2 in the week from the 6th to the 12th of March. There's been 243 in total. And as I said, I'll come on to long COVID later on in my presentation. And our all-cause mortality rate is 18% higher than the previous 5 years, which equates to 230 additional deaths. So again, just to explain this graph, the grey line is that average number of deaths we would see over a 5-year period, and the bars just show the number of deaths within any given week. And as you can see, the grey line doesn't really move outside of these grey bars, which are the confidence intervals. Councillor Bridgman, or Chair, apologies.
I'll have chairman as well. Thank you, Matt. Back in the room. So apologies for that, everyone. I'm going to blame inanimate objects. Yeah. Do we have any feel for when things come back into kilter? Clearly, all deaths are absolutely horrendous and regrettable, but we are talking about, in a lot of cases, fairly elderly people who have died, regrettably, but died earlier than the statistics might have predicted them to die. And so excess deaths, correct me if I'm wrong, effectively mean, in a lot of cases, advanced deaths. Question, therefore, is when does that filter out of the statistics, and when do you expect the curve to come back into line? I mean, I've had some officers in adult social care talking about 3 years. So I just want to get some feel for where we might expect to see the statistics work out.
Yeah, that's a good question. I mean, obviously we can see from this diagram, only April last year when we can actually see a statistically significant rise in the number of deaths of what we would have expected to see over any 5-year period. And actually since possibly late May last year, bearing maybe a few weeks, we've tended to align with that 5-year average. So in terms of where we currently stand, we're in line with that 5-year average. Obviously, you will get variations and fluctuations. It depends on the flu season as well in any given year. I guess obviously what we need to bear in mind, and maybe in relation to your question, is when it was quite high in April last year, that will obviously then play into that 5-year average. So we just need to accommodate that into our views. I'm not sure that answers your question. I'm not.
Well, I mean, I guess the question that I'm concerned with is clearly there are demands on the social care system. Long COVID is going to have an effect on the social care system. There are going to be people who require more care than they might have otherwise done. But then there are also going to be people who would have needed care, but are regrettably no longer with us. And so it's a question as to, in terms of the council and all care providers, working out what they are going, what level of need and they're going to have to satisfy going into the future, where we see those numbers going again, where, you know, in other words, if adult social care was predicting a certain level of demand in a year's time, do we think it is going to be roughly that level of demand, or less than that level of demand, or more than that level of demand? You know, in other words, is long COVID going to work against us? Excess deaths is going to, I don't want to make it sound like it's not going to work in our favor, but it's going to push the graph in the other direction. Question, where does that play out?
Yeah, I mean, I think I see Marion's got her hand in, but I think we're going to have to wait to see. In terms of we don't know what the impact of long COVID is going to be yet. We don't know the direct impact, the indirect harms of the pandemic in terms of people not seeking treatment earlier, the impact of a whole host of other things. So I think we have to put that into our calculations, and also population projections based on, sadly, those number of individuals that have lost their lives over the last year. But I see Meredith's got her hand up, so she might want to come in.
You're muted, Meredith.
Oh, it's the blue button, yes. Sorry about
that. This is the phrase of the year, as we've discovered.
Oh, it's unbelievable. I know. I get very annoyed with myself. I think we don't, as Matt said, I don't think we know enough about long COVID to know whether long COVID is going to cause additional people to go into social care. If we look at some of the most common reasons for people entering social care, most of those are probably not related to COVID. Some of them are related to falls, people who are having falls and they're elderly and long-term conditions and frail are more likely to end up in care homes. Smoking is a big one for COPD and people ending up in social care. So I think if you look at a lot of the reasons, long COVID is not causing the conditions that normally cause people to end up in social care. So I think it is possible that it might not create additional capacity, but at the moment, we still don't really know what the impact of long COVID is. I mean, what some people are reporting at the moment is basically tiredness, lethargic, affecting their muscles for 6-9 months after COVID and still having difficulty walking and breathing. And whether that turns into a disability such that they can't live at home, it's a bit difficult to know at the moment. But it's a good question.
Thank you. Sorry, I interrupted you, Matt.
Sorry about that. I couldn't unmute myself, so I didn't share my screen to unmute. I'll just start again. Right, in terms of vaccinations, just a very quick update. So there's been around 70,000 people that have been vaccinated with the first dose across West Berkshire. This is a really positive map, I thought. So this is a proportion of people aged 65 and over who received a first dose of the COVID-19 vaccine by something called a multi-super outbreak area. And what this shows is actually all wards within West Berkshire have now had at least 93% of first doses delivered for people aged 65 and over. So I think that's a really fantastic achievement. And as we know, obviously people over the age of 65 are more susceptible to the health consequences of COVID-19. So just quickly on long COVID, so that does lead nicely onto, I've only got 2 slides on this just because this was raised at the last board. As I said, we don't really quite know enough about long COVID. The clinical definition and the treatment pathway is minimal, and the evidence base is certainly evolving. In terms of what we mean by long COVID, the definition does vary, but people generally think that it's signs and symptoms that develop during or following an infection consistent with COVID-19 that continue for more than 12 weeks. I've seen some nice guidance actually refer to 4 weeks, and it's something that's not explained by an alternative diagnosis. What we do know from some of the evidence is about 10% of individuals that get COVID will suffer from long COVID. So if you look at our figures for West Berkshire, obviously we've had 6,700 or so positive cases, and we know that's also an underestimate because testing wasn't widely available at the beginning of the pandemic, so it's likely to be more than that. So approximately 670 people in West Berkshire could possibly have experienced long COVID since the pandemic began. I see a hand up from Councillor Burke.
Thank you, Matt. Matt, is there any evidence yet that the vaccination has any effect on the prevalence of long COVID?
That's a really good question. I don't know the answer. Obviously, we know in terms of it reduces hospital admissions. We know that it can also prevent transmission. However, what we know with long COVID is actually it's not necessarily linked to severity of symptoms. So people can have mild symptoms and have it and still get long COVID. One would assume that vaccinations will probably have a positive impact, but I don't believe that evidence is out yet, unless Merlin has any insight onto that. That's certainly something we'll be watchful on. In terms of the long COVID symptoms, so again, Merlin mentioned a few of these. They're varied really from extreme tiredness, shortness of breath, chest pain, difficulty sleeping, joint pain, depression, anxiety. So there's a whole host of different symptoms that are associated with long COVID that people report. In terms of what our local provision looks like in West Berkshire and more broadly Berkshire, the NHS released funding to establish 60 specialist long COVID clinics across the country at the end of last year, recognising that long COVID was now an established issue that needed support. So Royal Berkshire provides the Berkshire Long COVID Integrated Service within the pain management department within the Royal Berkshire Hospital, and essentially that's held every week, and it's around triaging. So it's very much about people being referred by their GP, seeing specialist team, multidisciplinary team of individuals, try and identify and make an assessment for that individual, and then signpost to the relevant service if needed. And I know they're looking to expand if they can actually provide support at the point of that assessment as well. So the latest data that I was able to get was since November the 30th, 263 referrals have been made to the service. So as you can imagine, that's quite a small number compared to Berkshire as a whole, although not everyone may have needed that support. And some of the data we got from the first 100 referrals into that service, just some highlight figures really, is asthma is the most common comorbidity, so 1 in 4 had asthma. And the common symptoms reported were fatigue, so 95%, so clearly that's experienced by a large number of individuals, shortness of breath 82%, concentration problems 72%, pain 64%. And then 65% of patients scored above the threshold for depression and 50% for anxiety. And the employment status changed for 27 patients, which is about 30% after their COVID illness. So a very small sample, but it gives you a flavour in terms of those patients that are going to that service and some of the signs and symptoms they're experiencing. So at the moment, the service is open to patients, paediatric and adults who may have long COVID and have been struggling with symptoms for more than 12 weeks. And as I said earlier, they can be referred by their GP. I've seen a couple of hands up, so I'll stop there.
Yeah, Matt, yeah, I actually think I got my hand up first, so I will not only take chairman's privilege, but also claim that, and then I'll hand over to Councillor Masters. Question. Asthma being the most common comorbidity for the experience in the Royal Berks as to long COVID, how does that compare to asthma as a comorbidity for coronavirus generally?
Yeah, I don't have that information to hand.
And I'm just wondering whether, whether there is some work, obviously there will be work going on about why some people will get long COVID and why some people won't, and whether it is the comorbidity that might point you in that direction. I just wonder. I presume work's going on that.
Yeah, I can certainly take that one away. Obviously, we know any chronic obstructive pulmonary disease, asthma, we know that those individuals have been more vulnerable to a degree. Although mild asthma, I don't think it's actually been reported as a key issue in terms of people getting COVID. I think it's more the severe asthma. But yeah, I'll certainly take that question away.
Councillor Masters.
Thank you, Chairman. Matt, thank you. In terms of diagnosis, if people are concerned that they may be having a number of those symptoms, etc., and they go to their GP, for example, how is the diagnosis taking place? Is it first that they're having an antibody test to confirm that they've had COVID previously, or is there a generic test for long COVID? I would imagine probably not at the moment.
No, I mean, as I said, the clinical diagnosis is varied, and I think the evidence is still emerging. I'm not sure the exact criteria, but as I say, people need to go speak to their GP. Whether or not there needs to be a confirmed diagnosis of COVID, I wouldn't have thought so, just because we generally know that many people have walked around asymptomatic, and I'd imagine the consultants in the multidisciplinary team would make that assessment in terms of what support they might need. But I have seen Shari's got her hand up, so she might be able to share some more information.
Thank you, Matt.
Yeah, so thank you, Matt. Yeah, there was national guidance provided on this, and patients did not need to have a COVID test to access post-COVID services. They need to have just been diagnosed with COVID, and whether they were hospitalised or not, or tested or not, they're allowed to access long COVID services, as Matt said, because of the early in wave one, patients weren't necessarily tested. So actually the service is available as long as they're presenting with with symptoms with GPs. Just wanted to clarify that for you.
Thanks very much.
So I'll just move on to my final slide. And this is just a very quick overview of the asymptomatic testing, because I recognise, again, it's one of those areas similar to confirmatory testing in terms of what people can access and who is eligible. So it's just a very quick overview. So in terms of eligibility criteria, at the moment, asymptomatic testing, so when I refer to lateral flow testing, this is what we're talking about. At the moment, it's available to, excuse me, households of nurseries, school children, members of support bubbles and childcare bubbles, and also critical or key workers unable to work from home, although the community collect is not yet available. So in terms of how individuals in the public can access asymptomatic testing or lateral flow testing or community testing, various different terminologies for this. Assisted testing is available. So we have some workplaces in West Berkshire that actually have set up testing sites within the workplace itself. So members of staff within those workplaces can go, and ideally we're recommending that people get tested twice weekly, and it is really important that people continue to get tested even if they're asymptomatic. Sometimes it can feel, why do I need to get tested? I don't have any symptoms, but the whole point of asymptomatic testing is to identify people who may unknowingly have COVID-19. And then we also have our community testing sites, which I've listed down to the left-hand side, which in West Berkshire we have Highwood Copse Primary School, Thatcham Rugby Club, Hungerford Rugby Football Club, and Burfield Community Sports Association. Now, actually from tomorrow, we'll also be starting community collection points. So within our community testing sites, individuals will be able to go to any of these 4 sites, and those, what I mean by individuals, it's these at the top here, are currently only available for the community collect scheme. They will be able to go to any of our 4 community sites and collect testing kits. At the moment, people are also able to collect their test kits through our regional testing site, which we have is at Newbury Showground between the times of 1 to 8 p.m. And what we expect soon to come online is pharmacy collect, so where individuals can go to a pharmacy and get their test kits, and they obviously test themselves at home. And then workplaces have also been invited by the government to also provide the opportunity for workplaces to provide testing kits to their staff, to not only just test inside, but can actually test at home as well. And then finally, there's the online ordering for self-tests. So we expect this to be expanded significantly. I think we recognise it is quite complex in terms of who is eligible, who's not. What I would recommend is they go to the West Berkshire Council website, and that's where all the relevant information is there in terms of who can access what and how. I think at the moment, the government are keen to introduce this as a phased approach, making sure those that access testing now need it. And over a period of time, I'd imagine that'll be expanded significantly, as I said, to a lot more people. The one thing we do recognise in West Berkshire is obviously the rurality. We're very much different to the other 6 local authorities in Berkshire with respect to that. So we're just working up a mobile community collect offer. And what we mean by that, be very much like a mobile library offer, actually go around the district and be able to distribute kits to eligible people. What we will do is make sure we advertise those times, the venues where they go, and then people can obviously turn up and collect their kits as required, so making it as easy as possible. That concludes my presentation.
Thank you, Matt. I can't see that anyone else has got any questions for you. So shall we move on to the next bit of the Matt Pierce show and local outbreak control plan? Matt again.
Yeah, I was just going to give a verbal update on this. I was hoping to share our plan, but at the moment it's currently sat with Public Health England and Department of Health and Social Care. So I was just going to give a brief update in terms of what we're up to, just so the public and the board can understand the plans we're making in terms of going forward. So many of you may recall we had to update or develop an outbreak control plan back in June of last year. So the government asked all local authorities to do that in partnership with our NHS colleagues, so that we were prepared to deal with any outbreaks throughout the district, but also to identify what restrictive measures we might need to put in place. So we did that, and we've been asked to update our plan in March this year. So we've done that, and I just wanted to cover a few things that we're looking at. And again, I'm happy to bring back a more formalised plan, maybe in a couple of weeks' time, if that's helpful, because we will be looking to publish this plan. So the sort of things that we're really obviously keen to focus on is surge testing, because that's a big area of concern that we know the public are concerned about. The variants of concern and any new variants that might come about, particularly from Europe. So we know the infection rates are rising in Europe. As infection rates rise, there's a real risk of any new variants coming about. So we need to be prepared that if a variant of concern is identified in West Berkshire, we would need to know how to act, how we need to test a significant number of people so we can identify those cases and isolate as quickly as we can. At the moment, about 75% of our cases in West Berkshire are what was formerly known as a Kent variant, but we know there's other variants across the world, whether it's the Brazilian variant, South African variant, where the evidence is unknown in terms of how beneficial the vaccination would be at reducing the impact of that variant. So surge testing is one key area. The next one is enduring transmission. So how do we then move to, I guess one would call normality, or a new normal, as some people refer to? So how do we maintain business as usual? How can we keep on top of local outbreaks? How can we ensure we can go back to the things that we all want to do, but at the same time be guarded about managing outbreaks effectively as we can and stopping them as soon as possible? The other one is around something called enhanced contact tracing. So the local authority is working very hard at looking at surveillance and data. We look at all the individual cases that come through, and when they're contacted by Test and Trace, we look at where they've been 2 to 7 days prior to testing positive, so we can actually identify those settings they may have been, and if there's commonality, or there's 5 or 6 or 7 cases that have actually been to the same setting, we can actually look at what control measures does that venue need a visit by one of our environmental health officers. Are they not necessarily being COVID safe? So surveillance is a really key part of that. Vaccinations goes without saying. Obviously, we need to keep on top of vaccinations, not just the first and second dose, but many of you know we likely will need booster vaccinations going forward, and we need to ensure the public understand and recognise the importance of vaccinations. we know that as vaccinations get offered to the younger age groups, we know that the uptake is likely to be lower, and that presents a real challenge. So we need to continue to make sure that people take their vaccinations when offered, and that will likely be for the foreseeable future and will form part of the national vaccination programme, I'd imagine. I've already talked a bit about testing. Again, we just need to maintain that testing offer as best we can, supporting vulnerable people, particularly people that need to self-isolate, and what support they get. And then, as I said, we need to manage outbreaks as effectively as we can. And then finally, governance, just to make sure that we know exactly how we do respond to an outbreak, how does that governance work, and how it gets escalated both regionally but also through our neighbouring local authorities. So I'll probably stop there. I think everyone's probably bored of my voice now, but that's a very brief update. Happy to take any questions on that. Equally happy to bring the plan back to this board when it's been finalised.
Matt, can I just clarify? The local outbreak control plan, this is the first iteration that has gone through the mill?
So sorry, the first iteration came out in June.
I'm just to clarify the cycle of these beasts.
Yeah, so I mean, the first one came out in June, and that's published on our website. That's in a PowerPoint format. We're looking to publish a more comprehensive update. I mean, they do get reviewed every couple of months, I'd have thought, but this is the first time we've been formally asked to review it.
Aha, that's the bit I didn't quite understand, follow that. So we've had to go through far more formality about this one than we have previously.
Yes.
Meriden.
Yeah, I was just going to say that there's a big difference between the beginning of the pandemic, when we produced our first outbreak plan last June, and this one. And the big difference is the recognition of local leadership, test and trace. And we now have the entire suite of data information, right from testing, tracing, isolation from the public, the contacts. So it is very different, and with that brings quite significant responsibilities around quality. And Matt mentioned at the end how we've had to set up a system for monitoring the quality of what we do, because we're actually now providing testing. We're actually bringing people at home, contact trace and that kind of thing. So I think there's the change is enormous from the beginning of the pandemic, which was sort of top down. We were the last to know often, and now a lot of this is now being run by us. So these outbreak control plans are actually quite important, and they may well be a feature for the future.
Thank you, Meriden. Thank you, Matt. See no further hands, so let us move on. So item 8 on the agenda is communications update. That's Martin. Over to you, Martin.
Thank you, and good evening, everyone. Just take you through what we've been up to over the past couple of weeks, and a look ahead to what we have planned coming up over the days and weeks ahead as well. A key focus for our activities over the past couple of weeks has been around the recovery roadmap and the move from step 1A to step 1B, which we did today. So over the past week or so, we've been making sure that we've been promoting what can and can't be done over the once the change has come into place, so that people know what they need to do to stay safe, and also just so they know that what the other steps are that are coming up later on. We to do that, link into the national messaging. There's materials produced by the National Government Department, which we share as a communications team. We attend a weekly government communication service briefing, so we're cited on what's coming up. We can plan for it, and we have those assets developed for us and ready to share. So you'll have seen us sharing those over the past few days. So from today, the messaging has changed. Stay at home has been retired, and it's moving to stay local. People are encouraged still to think about what journeys they're taking. Particularly over the run up to Easter. We're just going to be promoting that stay local message and encourage people, if they are travelling, to do so safely. The strap line for the next phase of the campaign is around hand, space, and fresh air, reinforcing the message that actually to two households, 2 bubbles can meet up to 6 people, but outdoors only. In terms of community testing, Matt's taking you through the changes that have been taking place around the opening up of testing to a wider community. We're continuing to let residents know what they can and can't access, who can get the testing. We'll continue to do that because it will continue to evolve over the coming days and weeks. We've been keeping the website, which Matt referred you to, updated. We've been working with businesses to encourage them to get their employees to visit the LFT sites. We've worked with the local enterprise partnership to help get that message out to businesses as well. And we've been encouraging residents, if they're out and about for legitimate reasons, to get testing as well. We've also been doing some work with schools to pick up a couple of specific issues. Number one, we had some feedback that the parents weren't always clear about how they could access lateral flow testing devices, and so we've been doing some communication with them just to let them know what their options are. It'll get easier soon as we roll out the community collect, and we've also been doing some work around bubbles and just making sure that parents and young people know that whilst they can mix in their school bubbles during the day, once they leave school, and afterwards they should continue to follow the regular social distancing rules. We've continued to send out our coronavirus bulletins. They're still being opened 40,000 times each week, continue to be an important channel for us in terms of getting our messages out to the community. We intend to continue doing those as we move through response and the rest of the roadmap. So it's not too late for anyone that's not signed up to those bulletins to subscribe. westberks.gov.uk/sign up is the place to go for that. So if we look ahead to what we've got coming up over the next few weeks, continuing to reinforce the message around what residents can and can't do at the moment, and prepare for the move, hopefully to step 2 on the 12th of April, which is around the opening up of hospitality and the further relaxing of restrictions. So we're going to be doing some work in support of businesses, promoting the work that they've been doing, particularly our local independents, to make themselves COVID secure and to open up safely, both to give residents confidence that they can come out and about and shop in their communities, but also to promote the range of local shops that we have here in West Berkshire. Similarly, we're looking at parks and open spaces as well, as people can mix more as we progress through the roadmap, and particularly outdoors. We expect our parks and open spaces to be really busy as restrictions are eased and as the warmer weather arrives. So we're working with our countryside team to make sure that as people do that, they continue to follow any rules that are in place, and also that they respect our parks and open spaces as well. And there's some other arrangements around extra bin emptying and what have you, which will be letting people know about too. In terms of testing, Matt's already run through some of the changes to testing and the community collect scheme, so we'll continue to be promoting those. We're working on an infographic as well, because we do appreciate there's lots of different ways for people to get access to testing. So we'll be doing an infographic just to make it easier for residents to know what's available to them and where they can go for that as well. We also, as part of the work Matt talked about around the local outbreak plan, we're reviewing the surge testing and local outbreak comms planning, just to make sure that those plans remain fit for purpose should we need them. In terms of health, we're going to continue promoting hands, face space and fresh air. And we're mindful we've got Ramadan coming up as well, so I'll be doing some work around that, both around vaccinations during Ramadan for those that are fasting, and also some reminders about how people can celebrate safely during Ramadan. And finally, we're working, just started work on an e-booklet, which we're going to share with our communities, just looking back at how we've been supporting communities over the past year through coronavirus, reflecting on all of the work that has been done in our communities. So that's a whistle-stop tour of what we're working on at the moment. Happy to take any questions.
Well, thank you, Matt. But in the words of our chairman, Councillor Pask, I think you've been let off lightly. No one appears to have anything to ask you, which is excellent. Thank you, members. We can move on. So the next item on the agenda is future agenda items. Now, before I come to any suggestions, let's just clarify that for the next meeting, we've got a bank holiday. Well, we've got two bank holidays. We've got a bank holiday weekend slap bang in the way of the time we would normally use to get agendas out. So next meeting is scheduled for the 12th of April. But because, as I say, of the bank holidays, we're going to need to publish the papers by the 31st of March. Now, that isn't that far away. So what will happen is we will get standard form agenda out. But if there are any speakers for additional items that haven't been confirmed over the next couple of days, then there'll be a fresh final agenda to go out nearer the time so that we know who's speaking and on what subject. We currently have meetings in the diary up to the end of April. I'm looking for thoughts from members as to the process going on. I think we should work, my personal view is we should work 6 weeks out, so we effectively place meetings on a rolling basis 6 weeks out and make decisions as we come to them as to whether or not these meetings should continue in their format and at the intervals we have. Councillor Doherty.
I was just going to make a suggestion for that agenda on the 12th, Councillor Bridgman.
Let's deal with the frequency of meetings, and I'll come back to you on that, if I may. So, Councillor Burke, is this on agenda items or frequency?
Frequency.
Right, please.
I think it's just a couple of months before we should be at the final relaxation of certainly the social aspects of the lockdown. I'd be happy for us to continue as well.
So if we carry on a rolling basis and make decisions as we need to going forward. Okay, I see some nods. Councillor Doherty, over to you on future agenda items.
The 12th of April is obviously a step in the roadmap, Councillor Bridgman, and just as we had Andrew Mackenzie from the Vineyard come and talk to us about the steps that hospitality had taken to safely reopen. I'm wondering whether it'd be useful to get somebody along from one of those non-essential businesses to talk about the steps that they have in place to give reassurance to people to come back. The one that springs obviously to mind for a lot of us is things like the hairdressers, and it might be just useful that we have that opportunity to hear what measures are in place, because I thought that was a really good session with Andrew on the hospitality, and I think it would just help to reassure anybody watching what that might look and feel like on the 12th of April.
Yeah, sounds like a plan. Anyone else got any ideas? I'm sure Gordon is rapidly scribbling notes as we speak. No, okay. Well, if you have any ideas in the next few days, then please do email them in, and we'll take them on board. But otherwise, leave it to Gordon and I to come up with something. That then is a future agenda items. Now, let me just go to any other business. Is there anything else anyone wants to raise that we haven't covered off in this meeting? A bit like Nelson and his ships, I see no hands. So there we will close the meeting, but I would ask, obviously, all panelists to remain in the meeting until the stream has been confirmed as closed down. Thank you.